back to my Brown Physio. I'm Dr. Neha Singh, and today in this video we're gonna study about recurrent dislocation of shoulder. It is also known as RDS. So recurrent dislocation of shoulder is a repetitive episodic dislocation of the shoulder in a person with history of initial acute dislocation. It is a very common complication of anterior dislocation. The cause can be failure of healing of torn avulsed capsule anteriorly, failure to immobilize shoulder for 3 to 4 weeks after initial dislocation, size and nature of damage at the time of initial dislocation. Younger the patient, less is the recurrence. Mechanism of action: depending on the individual, the mechanism of dislocation can be that is either predictable and avoided or unpredictable, thus make it very disabling problem. Pathological anatomy, that is heal such lesion in which posterolateral defect in the head of humerus is there. Bankart lesion, that is defect in anterior part of glenoid labrum and anterior capsule which creates a pouch anterior to the neck of scapula. Humeral head slips out with every dislocation. Third, erosion of anterior rim of glenoid cavity. Clinical feature: history of previous traumatic dislocation, repetitive dislocation during abduction, wasting of deltoid, supraspinatus and infraspinatus muscle, positive apprehension test sign. Investigation: X-ray, CT scan, MRI is also done to know any lesion. Treatment: both surgical and conservative. For conservative, there is no conservative management in redislocation of shoulder, only surgical management is there. That is Bankart operation and Letterjet procedure. Then Putty plate operation. You can pause the video and read about this surgical procedure. The goals are prevent redislocation of shoulder, muscle education and strengthening, movement training, and to achieve functional range of motion. Health education: we have to educate patient about the proper and careful use of his shoulder, to instruct to avoid movement as elevation, abduction and external rotation can cause redislocation again and again. Muscle education and strengthening: to strengthen ligaments and muscle. Exercise needs several repetitions. Self-resistive exercise in sitting or standing position is very needful and essential. Movement training: to achieve full passive range of motion. Patient in supine, patient will take the arm gentle, gradual, restrained manner in full range of motion. Patient carefully carry out these exercises at home after proper instruction. Now, for the surgical treatment, patient after surgery follows the same line as we saw in our previous video of dislocation of shoulder. Under that anterior dislocation, the main difference is the safety while performing the movements. The joint is stable as the head of humerus is enveloped firmly by overlapping of the divided parts of the subscapularis muscle. Passive sustained stretching is safe. External rotation remains deficient. Strong functional shoulder can be achieved within 10 to 12 weeks. That's it for this video.